नर्सिंग विद विनोद सर यूट्यूब चैनल में आपका स्वागत है। आज हम सभी नर्सिंग ऑफिसर भर्ती परीक्षाओं के लिए सर्जिकल ड्रेन से संबंधित मल्टीपल चॉइस क्वेश्चंस विद एक्सप्लेनेशन के बारे में चर्चा करेंगे। आइडेंटिफाई द इमेज। A. Double drain. B. Radiovac drain. C. Levine tube. D. Moss tube. The correct answer is B option I, Radiovac drain. Explanation. 1. A Radiovac drain is a type of closed suction drain used in surgical procedures to remove fluids like blood, pus, or serous fluid from a wound or surgical site. 2. Common uses. A. After surgical procedures, example, mastectomy, orthopedic surgeries. B. Managing abscesses or large wounds. C. Draining postoperative hematomas. The Radiovac system ensures efficient fluid removal with high negative pressure suction, unlike passive systems, example, Penrose drains, which rely on gravity. Identify the image. A. Double drain. B. Radiovac drain. C. Levine tube. D. Corrugated rubber drain. The correct answer is B option. Explanation. A corrugated rubber drain is a type of passive surgical drain used to drain fluids like blood, pus, or serous fluid from a wound or surgical site. Common uses. 1. Draining fluids after surgeries, especially in superficial wounds. 2. Managing abscesses or infected wounds. Identify the image. A. Double drain. B. Radiovac drain. C. Levine tube. D. Moss tube. The correct answer is A option. Explanation. 1. The double drain is a medical device used to remove fluid, such as blood or serous fluid, that accumulates in surgical or wound sites. 2. It is often used to help prevent the buildup of fluid that could lead to infection or delayed healing. Identify the image. A. Jackson-Pratt drain. B. Hemovac drain. C. Pigtail drain. D. Penrose drain. The correct answer is A option, that is Penrose drain. Explanation. A Penrose drain is a medical device used to drain fluids from a wound or surgical site, named after Charles Bingham Penrose, who developed it. Uses. 1. Post-surgical drainage. It helps remove fluids like blood, pus, or other secretions that may accumulate at the surgical site. Reducing fluid buildup aids in faster healing and prevents infection. 2. Preventing hematomas. By draining blood, it reduces the risk of hematomas, blood pooling, that can slow recovery or cause complications. 3. Infection management. In infected wounds or abscesses, the Penrose drain provides a pathway for pus and infectious fluids to leave the body, minimizing inflammation. 4. Soft tissue injuries. Identify the image. A. Jackson-Pratt drain. B. Hemovac drain. C. Pigtail drain. D. Penrose drain. The correct answer is B option, that is Hemovac drain. Explanation. A Hemovac drain is a closed suction medical device commonly used to remove fluids, such as blood or serous drainage, from a surgical wound or body cavity. It helps promote healing and reduce the risk of infection by preventing fluid accumulation. Uses. 1. Surgical procedures. 2. Orthopedic surgery, used after joint replacements, example, knee or hip replacement, to minimize swelling and fluid collection. 3. Abdominal surgery, helps drain fluid or blood from abdominal cavities post-surgery. 4. Breast surgery, used in mastectomies or lumpectomies to remove excess fluid. 5. Plastic and reconstructive surgery assists in reducing fluid accumulation in areas undergoing cosmetic or reconstructive procedures. 6. Cardiac or thoracic surgery. Drains blood or other fluids after heart or lung surgeries. Identify the image. A. Jackson-Pratt drain. B. Hemovac drain. C. Pigtail drain. D. Penrose drain. The correct answer is B option, that is Jackson-Pratt (JP) drain. Explanation. A Jackson-Pratt (JP) drain is a medical device commonly used after surgical procedures to prevent fluid accumulation and promote proper healing. It consists of a flexible silicone tube connected to a bulb that creates gentle suction when compressed. Common uses of a Jackson-Pratt drain. 1. Post-surgical fluid drainage. To remove blood, pus, or other fluids that collect in a surgical site, such as after abdominal, breast, or orthopedic surgeries. Commonly used in mastectomies, tummy tucks, and bowel surgeries. 2. Preventing hematomas and seromas. Hematomas, blood clots, and seromas, fluid collections, can impair healing. The JP drain helps minimize these risks by maintaining suction. 3. Infection management. Helps monitor and drain infectious fluid collections in patients with abscesses or postoperative infections. 4. Monitoring fluid output. The volume and appearance of drained fluid provide valuable insights into healing progression and potential complications. 5. Preventing wound dehiscence. By reducing fluid buildup, the JP drain decreases pressure on surgical incisions, preventing wound reopening. 6. Enhancing postoperative comfort. Preventing fluid accumulation can reduce swelling and associated discomfort. Identify the image. A. T-tube. B. Chest tube. C. Nasogastric tube. D. Foley S catheter. The correct answer is C option, that is nasogastric (NG) tube. Explanation. A nasogastric (NG) tube is a medical device inserted through the nose into the stomach. Uses. 1. Enteral nutrition. 2. Drainage of gastric contents. 3. Medication administration. 4. Gastric decompression, to relieve pressure or excess air in the stomach, commonly used in cases of bowel obstruction, ileus, or post-surgical recovery. 5. Aspiration of gastric contents for testing, to collect gastric fluids for diagnostic purposes, such as testing for pH or the presence of pathogens. 6. Prevention of aspiration, in patients at risk of aspiration, such as those with impaired gag reflex or consciousness, the NG tube can prevent food or fluids from entering the lungs. 7. Toxin removal. In some cases, an NG tube may be used for gastric lavage in cases of poisoning or overdose to remove ingested substances from the stomach. Identify the image. A. T-tube. B. Chest tube. C. Nasogastric tube. D. Foley S catheter. The correct answer is B option, that is chest tube. Explanation. A chest tube, also called a thoracostomy tube, is a medical device used to drain air, fluid, or pus from the pleural space, the area around the lungs. It is typically used in conditions where these substances accumulate and cause complications. Common uses of chest tubes include: 1. Pneumothorax, collapsed lung. 2. Pleural effusion, fluid buildup in the pleural space. 3. Hemothorax, blood in the pleural space in cases of trauma or injury. A chest tube can drain accumulated blood. 4. Empyema, infection with pus in the pleural space. Chest tubes can be used to drain infected fluid, often in cases of severe pneumonia. 5. Post-surgical use. After thoracic surgery, such as lung surgery or heart surgery, chest tubes help remove blood or air that may accumulate. 6. Chylothorax, lymphatic fluid in the pleural space. Identify the image. A. T-tube. B. Chest tube. C. Nasogastric tube. D. Foley S catheter. The correct answer is A option, that is T-tube. Explanation. A T-tube is a medical device typically used in biliary surgery and postoperative care. It is shaped like the letter T and is inserted into the bile duct to drain bile after surgery or injury to the bile ducts. Some common uses of a T-tube include 1. Biliary drainage. 2. Postoperative care. 3. Preventing bile duct obstruction. 4. Monitoring and management of bile flow. 5. Treating cholangiocarcinoma. Identify the image. A. T-tube. B. Chest tube. C. Nasogastric tube. D. Foley S catheter. The correct answer is D option, that is Foley's catheter. Explanation. 1. Urinary retention. 2. Monitoring urine output. 3. Surgical procedures. Foley catheters are often used during and after surgeries, particularly urological, gynecological, or abdominal surgeries, to keep the bladder empty and prevent injury. 4. Chronic medical conditions. Patients with conditions like spinal cord injury, multiple sclerosis, or severe prostate enlargement may require a Foley catheter for long-term management of urinary retention. 5. Bladder irrigation. Sometimes, the catheter is used for irrigating the bladder to remove blood clots or other obstructions, especially after surgery or trauma. 6. Incontinence management. Identify the image. A. Double drain. B. Hemovac drain. C. Levine tube. D. Moss tube. The correct answer is C option, that is Levine tube. Explanation. A Levine tube is a laboratory tool used primarily for microbiological studies. It is a type of test tube that typically contains liquid medium and is often used to grow bacterial cultures or test for the presence of specific organisms. The tube is named after Dr. Isadore Levine, who developed it. Main uses of Levine tubes. 1. Culturing bacteria. 2. Fermentation testing. 3. Testing for coliform bacteria. 4. Inoculation and dilution study. Thank you very much for visiting Nursing with Binod Sir YouTube channel. If you are new viewer, subscribe, like and share this YouTube channel to your friend circle. Stay in touch with this channel for more MCQ.